This is a PowerPoint presentation regarding the legalization of euthanasia and physician-assisted suicide by Stephanie Hartsock. The legalization of euthanasia and physician-assisted suicide is a highly debated topic. Euthanasia and physician-assisted suicide most commonly occurs in patients who have terminal cancer, or their diagnosis will likely result in a poor quality of life at the end of their life. The legalization of euthanasia and physician-assisted suicide has the potential to provide patients with a way to die with dignity and without suffering. Legal and ethical limitations prevent physicians from assisting patients with hastening the dying process. There are multiple states that have legalized euthanasia and physician-assisted suicide. These states have begun to lay a foundation for how to successfully implement these potential treatment options. Healthcare providers must be willing to advocate for their patients and protect their dignity and right to self-determination. The purpose of this presentation is to review the potential patient, legal, ethical, and alternative treatments associated with euthanasia and physician-assisted suicide. End-of-life issues can be challenging to talk about. Physicians may struggle with having these types of conversations because patients and their families are not prepared to hear this type of news. They're still hopeful that the physician will have good news and a better outcome for the patient. Healthcare providers typically have the belief that they must provide continued care in an effort to save a patient. If care withdrawn or a patient requests to die, the healthcare provider feels that they have failed the patient. Providing care at the end of life can be challenging because the use of palliative care or symptom management is still widely misunderstood. Many feel that the use of sedatives and pain medicine to keep a patient comfortable may actually be speeding up the death process. These misconceptions often compromise the comfort care that can be provided to the patient at the end of life. Many studies have shown that patients are more afraid of bad dying, or dying that involves pain and suffering, than the actual death itself. Historically, patients would die from acute illness and would not have long periods of suffering. However, with the continual advancements in medical practices, patients are surviving acute illness and living longer lives. However, patients typically are diagnosed with chronic illness that can be managed, allowing the patient to survive with the illness. While a patient may be able to live with the chronic illness, the illness may cause a decrease in the quality of life for the patient. Living a long life without being able to enjoy the things one enjoys to do is a form of suffering and should be considered when having end-of-life conversations. The legalization of euthanasia and physician-assisted suicide varies from state to state. Some states have moved forward with allowing euthanasia and physician-assisted suicide. The District of Columbia, Hawaii, Maine, New Jersey, Oregon, Vermont, and Washington are the states that have legalized physician-assisted suicide in the United States. These states agree that a physician will not be prosecuted for assisting a patient with ending their life. While the specific methods vary between states, most laws include writing a prescription for a lethal dose of a medication that will be injected or a patient would ingest. These laws also vary on the legalization of physician-assisted suicide versus euthanasia. In most states with legalized physician-assisted suicide, euthanasia is not permitted. However, the majority of states do not have laws that have legalized physician-assisted suicide. For instance, in Michigan, physician-assisted suicide is a punishable offense. Individuals that provide the means for a person to commit suicide or participate in the physical act of the patient committing suicide is subject to potential fines and imprisonment. However, Oregon was the first state in the United States to implement laws legalizing physician-assisted suicide. Oregon's Death with Dignity Act allows competent adults who are suffering from a terminal disease to request physician-assisted suicide. Patients must submit written requests to the physician responsible for their care. When completing the written document, the patient must have 2 witnesses present who can attest that the patient is competent and not being coerced into completing their request form. The physician must then validate that the patient's condition is deteriorating as a result of a terminal illness. A consulting physician then reviews the medical record to validate the diagnosis and agree that the physician-assisted suicide is an acceptable treatment option. If either of the physicians feel that a patient is suffering from psychiatric disorder, the patient will be referred to a counselor who will determine if the patient is mentally stable. Once everyone agrees that the patient is at the end of their life and capable of self-determination, the patient must wait 15 days. This waiting period allows the patient to truly make an informed decision and change their mind. Physicians are responsible for reporting all medications that are dispensed as a result of a request of a physician-assisted suicide. In addition to legal implications, there are also ethical considerations for physicians who may consider participating in physician-assisted suicide. Physicians take a Hippocratic oath that prevents them from harming patients or prescribing lethal doses of medications. According to the American Medical Association, rather than engage in physician-assisted suicide, physicians must respond to the needs of their patients at the end of life. Physicians should be prepared to be present for their patients despite the fact they are no longer able to provide treatment to save the patient's life. Patients and their families are going to have many questions when there are no other treatment options. Physicians must be prepared to answer these questions and ensure their patients and families are able to make informed decisions regarding their options. Physicians should also provide the emotional support that is needed by their patient and the family. Patients should also have access to the care that will keep them comfortable and provide the best quality of life for as long as possible. Managing the end of life can be time-consuming and challenging for physicians because they have other patients and families that require their services. Ensuring that patients have the information and tools necessary to die with comfort and dignity can be an overwhelming challenge. The Hippocratic Oath also guides physicians to do no harm. Subjecting a patient to additional treatment or prolonged life may be considered harmful. At the end of life, patients need to be able to define what suffering means to them. A physician cannot be the one to determine what suffering means for a patient. Patients may experience forms of suffering that a physician may not recognize based on the diagnosis. In order to honor self-determination, physicians must be willing to provide patients with all possible options at the end-of-life decisions, including euthanasia and physician-assisted suicide. In most cases, physicians do not often participate in euthanasia or physician-assisted suicide and need to be provided with the necessary tools to effectively cope with these situations. Providing a coping mechanisms may allow providers to recognize that they are assisting a patient in a dignified death that avoided suffering at the end of their life. Until euthanasia and physician-assisted suicide are legalized, other options for treatment at the end of life must be considered. One option, developed by Alexander Bannock and Dr. Philip Nashik, who used their engineering medical expertise to design a 3D printed euthanasia machine. The machine was created to offer patients a means to end their life in a peaceful and dignified manner. The patient lies in the capsule and pushes a button when they are ready to begin the process. The machine is then filled with liquid nitrogen that decreases the level of oxygen in the machine. This causes a rapid and peaceful death for the patient. The machine can then be used as a coffin for the patient's burial. The machine has stop, button, or escape hatch in the event the patient changes their mind. Having these options truly provides the patient with the ability to make their decision up to the end of life. Healthcare providers are responsible for providing patients with the right to self-determination. This type of technology allows the patient to make their own decision regarding the end of life without the healthcare provider having to be involved in the process. Additionally, voluntarily withholding nourishment is an option for a patient. There have been great advancements in palliative care for patients at the end of life. However, despite the best medications and comfort measures, some patients still experience a great deal of pain and a decrease in quality of life. This level of suffering has led patients to find alternative means for hastening the dying process. Voluntarily withholding nourishment is a patient's decision to stop taking any food or fluids. Voluntarily withholding nourishment protects the patient's right to self-determination and allows the patient to change their mind because it's not an immediate process. Choosing to stop taking nourishment allows the patient to make their own decision to the end of life without asking a healthcare professional to assist in hastening death. This method of decreasing the length of life may be a strong alternative to physician-assisted suicide because it does not require the violation of physicians' ethics and the law in order for the patient to make the decision at the end of their life. Palliative sedation is another method that can be used to help with suffering at the end of life. Palliative sedation is the use of medication to reduce the level of consciousness to alleviate pain and suffering related to symptoms at the end of life. Palliative sedation is only used once all other treatment methods for pain or distressing symptoms at the end of life have been exhausted. Palliative sedation provides the patient with the option to die naturally while avoiding the pain and suffering associated with life. This alternative to physician-assisted suicide also allows caregivers to provide the patient and their families with the information regarding palliative sedation and allow them to make an informed decision prior to starting the process. There are some that may argue that palliative sedation is unethical and should not be offered as a form of treatment. The argument is that palliative sedation is a form of euthanasia. However, the difference is that euthanasia occurs when there is intent of administering medication to end a patient's life. Palliative sedation is strictly utilized to reduce consciousness so patients do not suffer at the end of life. Palliative sedation allows a healthcare provider to deliver care that decreases suffering at the end of life. This type of treatment does not violate the Hippocratic Oath and allows the patient to avoid unnecessary suffering at the end of life. The Christian view regarding euthanasia and physician-assisted suicide can be difficult to determine. Those that are against euthanasia and physician-assisted suicide may argue that God is the one to provide life and should be the one to determine when life should end. God has provided healthcare providers with the ability to advance healthcare and increase the ability of prolonging life. These advancements have allowed healthcare providers to prolong life even when the outcomes will still be death. In addition, euthanasia and physician-assisted suicide may be considered a form of murder, and the Bible tells us, "You shall not murder." Euthanasia and physician-assisted suicide have the intention of ending life, therefore it may be considered a form of murder despite what a law may say. Additional factors must be considered when arguing the Christian view on euthanasia and physician-assisted suicide. God has also granted Christians with the ability of self-determination. Christians have been given the ability to make their own decisions. The intention is that Christians will make decisions that are righteous and well-intentioned. Proverbs 2:21 states, "We justify our actions by appearances. God examines our motives." God will look at a decision made and determine if the motives are harmful. For patients, the decision to request euthanasia or physician-assisted suicide is not meant to be ill-intentioned or to go against God's will. Patients requesting euthanasia or physician-assisted suicide have already learned that they will die as a result of their diagnosis. Choosing euthanasia or physician-assisted suicide allows a patient to make a decision regarding the end of their life. God has created all humans in His image, and therefore all human life is invaluable and should be treated with dignity. This extends to end-of-life decisions. Patients should not be required to suffer at the end of life. This includes physical suffering as well as emotional suffering as a result of a decrease in the quality of life. Patients at the end of life should be given the option to decide if their physical suffering or decrease in quality of life is harming a patient's dignity. Patients should be provided the option to choose a dignified form of death over a long process filled with suffering. Christians must also be God's stewards, ensuring justice among the society. Cumulative justice guides Christians to ensure that all humans are provided the right to dignity. Legalizing euthanasia and physician-assisted suicide allows healthcare providers to provide patients the option to avoid suffering at the end of life and choose a dignified death. Additionally, Christians are responsible for ensuring procedural justice. This type of justice ensures that practices are fair and the reason for the practice has a positive motive. Legalizing euthanasia and physician-assisted suicide should have laws and regulations that guide the practice. It is imperative that physicians have strict guidelines to ensure that patients are well informed and have all the information prior to choosing euthanasia or physician-assisted suicide. Laws and regulations must also require reporting and documentation of the patient's request. This will help to describe the steps and information provided to the patient to ensure that the patient made an informed decision of their own free will. The legalization of euthanasia and physician-assisted suicide is a highly debated topic. Many healthcare professionals have ethical beliefs that do not support assisting the patient with hastening death. The Hippocratic Oath prevents physicians from causing harm. However, continuing life-saving measures for a patient that is at the end of their life may be causing harm. The reasons a patient may be considering euthanasia or physician-assisted suicide must be considered when determining if euthanasia or physician-assisted suicide are appropriate. Patients have the right to self-determination and dignity. The end of life may cause suffering and a decrease in quality of life. This must be considered when determining if treatment should be continued or if a patient has the right to choose to hasten the dying process. Several states in the United States have determined that physician-assisted suicide is an acceptable practice and provides the patient with the ability to make a decision regarding their care. Legalizing euthanasia and physician-assisted suicide needs to be regulated to ensure that patients are protected and making informed decisions. Oregon's Death with Dignity Act provides a foundation of what regulations need to be in place to successfully allow patients to choose physician-assisted suicide. The Death with Dignity Act ensures that physicians have provided necessary information and consultation for competent adults to make their own decision regarding the end of life. Alternatives to euthanasia and physician-assisted suicide must also be considered until euthanasia and physician-assisted suicide are legalized. 3D printed euthanasia machines, voluntarily withholding nourishment, and palliative sedation are options for hastening death that do not require healthcare providers to violate their legal and ethical obligations. However, healthcare providers should be advocates for allowing patients to the right of dignity and self-determination. Patients should have the right to choose the course of their treatment, including euthanasia or physician-assisted suicide. All humans have been created in the image of God and should be treated with dignity. This dignity must include end-of-life decisions.